Elizabeth Blackwell made it possible for women to have a place in the medical field. I myself want to be a neonatologist one day because my neonatologist helped my family out a lot when I was a little baby. So to be able to have the dream even to be a physician was not a task that Elizabeth Blackwell had faced. She started out with a really motivated family. Her dad worked in a factory, her mom was a teacher, she had 2 other siblings, and all of them were female. Her family actually encouraged her to go and encouraged her to motivate herself to do that extra step to go to school. And she did, because she started applying to medical school. However, she didn't always want to be a medical physician or anything in the medical field. She started out and she was grossed out by blood and she didn't want anything to do with it. She decided that she didn't want anything to do with the medical field until one of her close friends became diagnosed with cancer. Her friend didn't like going to the doctor and getting help because the male physicians didn't understand what she was going through. Also, she had cervical cancer, and just the stigma of looking at those parts, and especially having a male physician or a male healthcare professional looking at her, made her feel uncomfortable. So unfortunately, she did pass away due to this disease, and Elizabeth Blackwell felt very sad and motivated that she couldn't do something to help her friend, but now she wanted to do something to help other women so that they don't have to go through this struggle. So she decided to make a difference. There were 1 billion people telling her not to do what she was about to do, but she believed in herself 200% and she pushed herself to the next level. She started applying to medical schools, 31 to be exact. And after being rejected by 30 other medical schools, she got accepted by one, Geneva Medical College. It started out as a joke, and the male students wanted to have a female student to have as entertainment. The professors had let the male students vote on whether they wanted to have Elizabeth Blackwell come and join them at their school, and they voted yes. So Elizabeth showed up, and in her autobiography, she basically mentioned about how hard it was for her to be taken seriously in some sort of aspect. The professors, even though some of them were kind and did want to help Blackwell accomplish her dream, they thought that a female wasn't suited to certain topics. For example, when they were talking about the reproductive system, the teacher that she looked up to the most turned to her and he told her that she might want to walk out because this information wasn't suitable for a woman. But she stood up in class and in front of everyone, she told them that she didn't want to be treated differently. And if she was to become a doctor that helped other women, she was supposed to know how this worked and how our bodies functioned. Because it didn't matter what system or what topic they were talking about. It depended on whether she'd be able to help the individual. So she wanted to know this information. And at the age of 28, she did graduate, and she was the first female physician in the United States. And not only did she graduate, she was at the top of her class. So she managed to gain the respect of all of her classmates. Now she moved on with her life, and when she was in England, she got this virus or some sort of infection that affected her vision. And this was during the time where she was helping other women and other females in the medical field by showing that if she did it, they could do this too. So she got this infection in her eye, and she was very scared because in order to be a physician, you need to be able to use your hands. You need to have that hand-eye coordination because you're supposed to be dealing with the patients. So when she got this infection in her eye, it caused one of her eyes to be blind. And this took away her dream of being a surgeon, of being any sort of doctor that actually goes in and does invasive surgery. So it sort of shattered her dreams, but she didn't let this stop her. So she took another path to medicine, and she took more of the educational / motivating other women to accomplish their dreams. When she was in England, she befriended Florence Nightingale, which we all know to be one of the founding female nurses who paved the path for people in England to go into the nursing field. And when she met Florence Nightingale, she learned different techniques. She learned how many women still are afraid to take that chance to go into medical school or even to be a nurse. Well, women were just seen to be able to be midwives and help with pregnancy. But this wasn't true, and she was a living example of it. So it really shows how she was being connected to other women, and she was paving the path for future women to do anything. She was helping set examples of what women can do and how they aren't all useless and only good for baby making. The Civil War started to happen in the United States, and Blackwell, being who she was, decided to go help. She was in charge of appointing new nurses into the army and training them and making sure that everything was going as efficiently as possible. And now when she was over there, she saw how many people were just being killed by infection in the battlefield. So she went and she figured out what was really causing all of this death, because all the nurses were doing what they could. In the battlefield, there's no way to make sure that everything is sanitized. But she realized how important infection control and having everything sterile and even sanitizing the knives and the scissors and all of that they're cutting into the soldiers' fleshes are. So at this point in time, she used all this knowledge, and she made sure that the nurses and the people who were under her control in the army knew how to sanitize their equipment to the best of their ability, and of course in the circumstances, and she saved so many people's lives. And that was sort of the starting action that propelled sanitization and sterilizing medical equipment in America and all over the world. So she was really one of the founders over there. As she went on, she adopted a daughter, Kitty, and she didn't let anything stop her career, but she did raise a very good daughter. She went back, and at this point she was getting older. She was helping women all over to achieve their dreams. She was hosting different rallies, helping different hospitals, and getting women out into the world, getting exposure. And she was about 60, 70 years old when she went back to New York City. And in New York, she founded a hospital run by women. So she appointed all female physicians, female nurses, and she showed what girl power could really do. So I really appreciate that she did that, because it still exists to this day, the New York Hospital for Women and Children. She went back to England, and unfortunately, she passed away in the United Kingdom, and it was due to natural causes, and she was buried in Scotland where she wanted to be buried. But she really did show what women could do. And we always hear about Susan B. Anthony, but she's one of the most unspoken heroes of the medical industry. And she made it possible for women like me to even dream to be working in the medical field. So she's a global action leader who I admire, and I'm really happy I had the opportunity to look into her background and really take her as my role model so that I could follow in her footsteps and create my own footsteps and really make a difference in this world.